I heard that Dr. Pinter's program director had a serious talk with him. The policy around here is zero tolerance for that type of behavior. He's going to get the counseling he really needs.
Look, I've been waiting for over 10 minutes for you to get that patient placed in a room and ready for an exam. What have you been doing?
Well, there were no rooms. I had to wait.
Do you do anything around here other than make excuses?
Dr. Pinter, the patient, she'll hear you.
Well, maybe she should hear me. I mean, she should know that somebody around here cares that she's been waiting. I mean, what, you think she views you as a model for efficiency?
But you'll upset her.
Well, I imagine she's already upset. I mean, to depend on somebody like you? I mean, how does a person like you even get through nursing school? I mean, where'd you go? They clearly, wherever you went, they did not teach you about how to work in the real world. I mean, if you can't get a patient set up in a room in a timely fashion, I can't imagine you giving you any kind of great responsibility.
Dr. Pinter, is there a problem here?
Nothing that a little competence can't fix.
Dr. Pinter, your patient is going to want to be looked at. Yeah. Sally, can I have a word with you?
Sure.
Don't pay any attention to him. He's developing quite a reputation around here, and he's just being his usual charming self. Ignore him. Come on, let's see you just hang tough.
Look, I've been waiting for over 10 minutes for you to get this patient set up in a room and ready for an exam. What have you been doing?
I'm sorry, no rooms were available. I had to wait.
Do anything around here other than make excuses?
Dr. Pinter, the patient, she'll hear you.
Well, maybe she should hear me. I mean, she should know that somebody around here cares that she's been waiting. I mean, what, you think she views you as a model for efficiency?
But you'll upset her.
Well, I imagine she's already upset. I mean, to depend on somebody like you? I mean, how does a person like you even get through nursing school? Where did you go anyway? I mean, wherever you went, they clearly did not teach you about how to work in the real world. I mean, if you can't get a patient set up in a room in a timely fashion, I can't imagine giving you any kind of greater responsibilities.
Dr. Pinter, is there a problem here?
Nothing that a little competence can't take care of.
Will you excuse us for a minute, Sally?
Sure.
Dr. Pinter, could you close the door, please? Dr. Pinter, regardless of what you may think of Nurse Prin's ability, your behavior is unacceptable. If you have some concerns regarding how we are functioning here, you need to speak directly to me.
But she was not operating under proper
I will
procedure.
speak to our program director, and I will request that you are given information on how to communicate effectively any concerns that you may have.
But you're still not hearing what
The next step is between you and the program director. I feel, however, that you do owe Miss Prin an apology. Also, if you will find it useful, the three of us can get together and discuss how we can communicate more effectively in the clinic as a team. Thank you, Dr. Pinter.
Thank you.
When I was an intern, I was yelled at once by a doc who didn't like the way I changed a patient's dressing. I've even had them insult me over a treatment plan. Nurses like Miss Prin aren't the only targets for physicians' bad behavior. PAs, techs, administrators, and even more junior physicians are all potential targets. And patients are even potential targets. Fortunately, though, the culture is changing. It's much less tolerant of unprofessional behavior.
I hate it when I get yelled at. Sometimes I just feel like quitting. My friend Ellen, she got yelled at by some doctor who said her chart was incomplete. She not only screamed at her in front of 2 technicians and a PA, but she kept jabbing her finger in Ellen's face. Can you believe that?
Once a pattern of disruptive behavior has been identified and a confidential investigation has confirmed the veracity of the complaint, the next step is to speak formally to the resident. The program director is best positioned to take control of this intervention, which should then be followed by referral for evaluation. Treatment, if needed, can then be recommended and carried out either by a resource such as the hospital's employee health program or a physician's health program. A state physician's health program has the advantage of working exclusively with clinicians. Peers are better positioned than a non-medical person to challenge any instances of denial on part of the resident. If, however, the resident refuses to acknowledge the disruptive behavior or follow any recommendations provided, emphasize that dismissal is a very real consequence. Unfortunately, many physicians with disruptive behavior have personality disorders. These are not easily treated, the success rate being less than it is for physicians with chemical dependence. Nonetheless, it is important to at least attempt rehabilitation and have a clear, fair, and well-documented process for termination from the program for those cases where rehabilitation fails. Program directors and institutions will need to be realistic in their expectations. If the medical environment is to function optimally, collegiality and mutual respect must be fostered and cherished. Disruptive behavior has been defined as any pattern of behavior that causes conflict, chaos, disharmony, dysfunction, and/or anxiety in the medical environment. It is best characterized by a power imbalance between different parties, a physician and a nurse, for example, or a senior versus a junior member of the team. The imbalance of power is then exploited and abused. Disruptive behavior can affect the workplace to such a degree that others are unable to fulfill their duties or care effectively for patients. It can also increase staff absenteeism and turnover markedly. Some groups may be unable to hire other members of the healthcare team. Disruptive behavior must be addressed quickly and directly. Tolerating and excusing the behavior risks encouraging further similar behavior. With this in mind, let us see how Sally's situation might have been handled more appropriately. In the past, a physician's disruptive behavior was often tolerated. Faculty role models themselves may have behaved in a disruptive manner, making it even more difficult to manage. However, disruptive behavior has become increasingly unacceptable because of its adverse impact on patient care, on the institution, and on employee morale. Patient care is at risk when a nurse's fear of a physician reduces their willingness to communicate vital information. It is also at risk when nurses must shift their focus from caring for patients to managing physicians. Disruptive behavior can lead to charges of a hostile work environment, harassment, and racism, all of which can have severe legal and financial consequences for the institution. Co-workers and patients may make direct reports to the state medical board that can result in licensing restrictions or revocation. This segment of the LIFE program has been designed to help you recognize and discourage disruptive behavior when it occurs and to prepare you to intervene so that the behavior can be dealt with constructively and effectively. In my experience, program directors and faculty usually tolerate disruptive behavior far too long, most with the mistaken hope that the behavior will resolve spontaneously. In today's healthcare environment, ignoring or tolerating it is not a viable option. Institutions need to develop a clearly stated code of conduct as well as policies and procedures for dealing with violations of institutional standards. While no code can be exhaustive and catalog every possible situation, it should, as clearly as possible, describe unacceptable behavior and outline the consequences if professional standards are violated. The ACGME competencies help a great deal. They emphasize interpersonal communication skills, professionalism, and teamwork.